Have you ever woken up, perhaps after a peaceful nap, only to find your hand or arm buzzing with a strange, prickly sensation? Or maybe you're just sitting, watching your favorite show, and suddenly your fingers feel like they're filled with pins and needles for no clear reason. It's a common experience for many of us as we get a little older, and while it often goes away quickly, it can be quite unsettling. That persistent tingling, especially in your hands after 60, isn't just a fleeting annoyance. It can sometimes feel like a daily companion, making simple tasks like buttoning a shirt or holding a teacup feel clumsy or even painful. Ignoring it means missing out on the full comfort and independence you deserve. What if those sensations are your body trying to tell you something important? Something that, if understood, could lead to a deeper sense of well-being and a calmer, more comfortable daily life. In this video, we're going to gently uncover the common reasons behind those tingling hands, exploring everything from everyday habits to signals that might need a closer look. We'll discover how understanding these signals can truly make a difference in your comfort and confidence, letting you fully embrace every moment. And be sure to watch to the very end for something that will truly surprise you about how your body communicates with you. So, let's dive right into what might be going on when your hands start to tingle, and how you can gently encourage them to feel more comfortable. One of the most frequent culprits, believe it or not, is simply how you position your body. Think about it. How many times have you fallen asleep with your arm tucked awkwardly under your head? Or perhaps leaned on your elbow while reading a good book when we put pressure on nerves or restrict blood flow for an extended period? It's like kinking a garden hose. The signal, or the water in this analogy, can't flow properly. This is often why you get that classic pins and needles sensation. It's your nerves waking up and sending scrambled signals as blood flow returns and pressure is relieved. It's usually nothing to worry about, and it resolves itself once you move. However, if you find yourself waking up consistently with numb or tingling hands, it might be worth paying a little more attention to your sleeping posture. Perhaps trying a different pillow that supports your neck better, or consciously avoiding sleeping directly on your arms, even during the day. If you work at a desk or spend a lot of time sitting, be mindful of leaning on your wrists or elbows for long periods. Simple adjustments, like using armrests, taking regular breaks to stretch, or simply changing your position every now and then, can make a world of difference. It's all about giving those nerves and blood vessels a clear pathway to do their job without interruption. This brings us to another surprisingly common cause for tingling hands: a simple deficiency in certain essential nutrients. Our bodies are incredibly complex machines, and like any machine, they need the right fuel and components to run smoothly. Specifically, certain B vitamins, particularly vitamin B12, play a crucial role in nerve health. Without enough B12, the protective sheath around our nerves can start to break down, much like insulation on an electrical wire. When this happens, those nerve signals can get muddled, leading to sensations like tingling, numbness, or even weakness. As we get older, our bodies sometimes have a harder time absorbing B12 from food, even if we're eating a balanced diet. This is why B12 deficiency can be more common in the over 60 age group. You might also notice other signs like fatigue, memory issues, or feeling a bit unsteady on your feet. Foods rich in B12 include meat, fish, eggs, and dairy products, as well as fortified cereals and plant-based milks. If you follow a vegetarian or vegan diet, or if you've had gastric surgery, you might be at a higher risk, and it's especially important to ensure you're getting enough, perhaps through fortified foods or supplements. Always chat with your doctor before starting any new supplements, as they can help determine if a deficiency is indeed the cause and guide you on the right dosage. Another frequently encountered cause of tingling in the hands, especially the thumb, index, middle finger, and part of the ring finger, is something called carpal tunnel syndrome. This happens when the median nerve, which runs from your forearm into the palm of your hand and controls sensation to those fingers, becomes compressed at the wrist. Imagine a narrow tunnel, and through that tunnel passes this important nerve along with several tendons. If the tissues around these tendons swell or become inflamed, the tunnel gets even tighter, putting pressure on the nerve. This pressure can cause tingling, numbness, pain, and sometimes even weakness in your grip. It's often worse at night, waking people up, or when performing repetitive hand motions like typing, gardening, or even knitting. Many people find relief by making simple adjustments to their daily routines. Ergonomic adjustments, like ensuring your keyboard and mouse are at a comfortable height, keeping your wrists straight rather than bent, and taking frequent breaks to stretch your wrists and fingers can be very helpful. Wearing a wrist splint, particularly at night, can also keep your wrist in a neutral position and alleviate pressure on the nerve. Simple stretches, like gently extending your hand back with your palm facing away from you, can also help. If these simple measures don't bring relief, or if the symptoms worsen, it's a good idea to consult your doctor. They might suggest physical therapy or other treatments to help manage the condition and prevent further nerve damage. Understanding these common culprits is the first step towards finding comfort and regaining the full use and sensation in your hands. Now that we've discussed how simple positioning, nutrient deficiencies, and carpal tunnel syndrome can contribute to that tingling sensation, let's move on to other factors that might be at play, some of which require a closer look. Beyond those everyday occurrences we just talked about, there are other factors that could be contributing to that tingling sensation in your hands, and these often involve the nerves themselves. One significant cause is something called peripheral neuropathy. Imagine your nerves as a vast network of telephone wires connecting your brain and spinal cord to the rest of your body. Peripheral neuropathy is essentially damage to these wires outside of your brain and spinal cord, especially those that reach your hands and feet. This damage can disrupt the signals, leading to sensations like tingling, numbness, burning, or even sharp pains. What causes this nerve damage? Well, several underlying health conditions can be culprits. Diabetes is one of the most common. Over time, high blood sugar levels can damage nerves throughout the body, including those in your hands. That's why managing your blood sugar effectively through diet, exercise, and medication, if prescribed, is incredibly important, not just for overall health, but for nerve health too. Certain medications, especially some used for chemotherapy or HIV treatment, can also cause peripheral neuropathy as a side effect. Excessive alcohol consumption over many years can lead to nerve damage due to nutritional deficiencies and direct toxic effects on the nerves. Kidney disease, liver disease, and even certain autoimmune conditions can also play a role. If you have any of these underlying conditions and are experiencing persistent tingling, it's vital to work closely with your doctor to manage them effectively. Sometimes, simply bringing the underlying condition under control can significantly improve or even resolve the nerve symptoms. Another area where nerves can get pinched, leading to hand tingling, is in your neck or upper spine. This is known as nerve compression or radiculopathy. Think of the nerves that supply your arms and hands as originating from your spinal cord in your neck. If there's any narrowing of the spaces in your spine, perhaps due to age-related changes like bone spurs, bulging discs, or even arthritis, these nerves can get squeezed as they exit the spinal column. This pressure can cause symptoms that radiate down your arm into your hand, manifesting as tingling, numbness, weakness, or even pain. It's often worse with certain neck movements or positions. Maintaining good posture throughout the day is a simple yet powerful preventative measure. Avoid prolonged slouching, especially when looking at screens, and ensure your workstation is set up ergonomically. Gentle exercises that promote neck and shoulder mobility, like slow neck rotations or shoulder rolls, can also be beneficial by keeping the surrounding muscles strong and flexible. If you suspect your neck might be the source of your tingling, it's worth discussing with your doctor or a physical therapist. They can assess your posture, range of motion, and suggest specific exercises or treatments to decompress the nerve and alleviate your symptoms. Sometimes, even issues that seem unrelated to your hands can cause tingling. An underactive thyroid, a condition known as hypothyroidism, is a surprising example. Your thyroid gland, located in your neck, produces hormones that regulate your metabolism. When it's not producing enough of these hormones, it can affect almost every system in your body, including your nerves. An underactive thyroid can lead to fluid retention, which in turn can put pressure on nerves, including those leading to your hands. You might also notice other symptoms like fatigue, weight gain, feeling cold, dry skin, or hair loss. If you're experiencing these symptoms along with tingling hands, it's a good idea to have your thyroid function checked with a simple blood test. If hypothyroidism is diagnosed, medication to replace the missing thyroid hormones is usually very effective and can often resolve the tingling sensation as your body's metabolism returns to normal. It's a great example of how different parts of your body are interconnected and how a seemingly unrelated issue can manifest in your hands. Understanding these deeper connections helps us appreciate the intricate workings of our bodies and empowers us to seek the right solutions. Next, we'll dive into when it's truly important to seek medical advice for these tingles and what simple lifestyle shifts can support overall nerve health. Now, while many of these causes for tingling hands can be managed with simple adjustments or understanding, it's crucial to know when that tingling might be signaling something more serious, something that truly warrants a chat with your doctor. Most of the time, tingling hands are nothing to be overly concerned about. But there are certain signs that mean you shouldn't delay seeking professional medical advice. If the tingling is sudden and severe, or if it comes on after an injury, that's a red flag. Similarly, if the tingling is accompanied by weakness in the hand or arm, difficulty moving your fingers, or a complete loss of sensation, or if it spreads rapidly to other parts of your body, you should seek immediate medical attention. Another important sign to watch for is if the tingling is persistent and doesn't go away, or if it gets progressively worse over time, rather than coming and going. If it interferes with your daily activities, like buttoning clothes, gripping objects, or walking, then it's definitely time to get it checked out. Also, if you have other symptoms like unexplained weight loss, fatigue, changes in vision, or muscle wasting along with the tingling, these could be clues pointing to an underlying condition that needs diagnosis and treatment. Remember, this video is here to offer information and guidance, but it's never a substitute for personalized medical advice from a healthcare professional who knows your individual health history. They can perform the right tests, make an accurate diagnosis, and recommend the best course of action for you. Taking proactive steps for your overall well-being can significantly support nerve health and potentially reduce or prevent those tingling sensations. One of the simplest yet most profound ways to do this is through a balanced and nutrient-rich diet. Think of your nerves as delicate electrical wires that need specific nutrients to function optimally. Foods rich in B vitamins, like lean meats, fish, eggs, dairy, and fortified cereals, are crucial. Magnesium, found in leafy greens, nuts, and seeds, also plays a role in nerve function. Antioxidants from colorful fruits and vegetables help protect nerves from damage. Focusing on whole, unprocessed foods and limiting sugar, unhealthy fats, and excessive alcohol can create a supportive environment for your entire nervous system. Hydration is another unsung hero. Dehydration can affect nerve signals and overall body function, so simply drinking enough water throughout the day can make a difference. Gentle, regular movement is also incredibly beneficial. You don't need to run a marathon, even a daily walk. Gentle stretching or movements that improve your posture can help. Activities like Tai Chi or gentle yoga are wonderful for improving balance, flexibility, and circulation. which in turn supports nerve health. These movements can help release any mild nerve compressions and improve blood flow to your extremities. For instance, simple hand exercises, like making a fist and then spreading your fingers wide, or rotating your wrists gently, can keep the blood flowing and prevent stiffness. Also, paying attention to your posture, whether you're sitting, standing, or sleeping, can prevent unnecessary pressure on your nerves. If you spend a lot of time at a desk, make sure your chair and computer are set up to support a neutral spine and relaxed shoulders. Taking short breaks to stand up, stretch, and walk around every hour can also prevent prolonged compression. Finally, don't underestimate the power of stress management. Chronic stress can impact your entire body, including your nervous system. Finding healthy ways to manage stress, whether it's through meditation, spending time in nature, pursuing a hobby you love, or simply connecting with friends and family, can contribute to overall nerve health and reduce inflammation. Your body is incredibly resilient. And often, these signals, like tingling hands, are just prompts for small, positive changes that can make a big difference in how you feel every day. Remember, you have the power to influence your well-being with thoughtful choices and by listening to what your body is telling you. Have you experienced tingling hands? What insights or solutions have you found helpful in your own journey? We'd love to hear your experiences and wisdom in the comments below. Sharing your story might just help someone else who's going through something similar. If you found this video helpful, please give it a thumbs up. It truly helps us reach more people who could benefit from this information. And don't forget to subscribe to our channel for more practical tips and insights on living your most vibrant, comfortable life at every age. You deserve to feel your best. Every single day, live your best life, vibrant and comfortable, at every age.